I'm really excited to share this research with you. And we did the scoping review over the last 5 months, and the whole team is based at the Substance Use Research Group at Glasgow Caledonian. And as Catherine and Lindsay already said, we were funded by the Institute of Alcohol Studies small grant scheme. So a big thank you to them for funding this research. So today I will start with a brief background to our review, talking more generally about men and alcohol before focusing more on parenthood and the importance of fathers. I will briefly go over the review aims and methods, and I will spend the last part of the seminar talking about our review findings and their implications before opening up for questions and answers. So men generally drink considerably more alcohol than women. And according to the World Health Organization's latest data, harmful use of alcohol is accountable for 7.1% of the global burden of disease for men, which is over 3 times that for women. If we look at Scotland, hazardous and harmful drinking for men is twice as much as that for women. Also, men are less likely to be non-drinkers. And on average, in Scotland, men drink more alcohol units per week than women. And you can see here that that's almost double of what women drink per week. And data for the rest of the UK is quite consistent in showing that men tend to drink more than women on average. And there are gender-specific explanations for why men might drink more, drink differently than women. The first one is that public drinking may be related to perceptions of masculinity. So men might think that being drunk in the public is a sign of being more masculine or more macho. And it's worth noting here that there has been a change in this in recent years and the emergence of the feminized nighttime economy, where it's becoming more acceptable for women to display public drunkenness outside in the nighttime economy and venues. The second explanation for the relationship between men and alcohol is that drinking may be associated with male friendships. And research shows that men perceive drinking to be important for creating and maintaining friendships. Seeing their friends in the pub can also help elevate men's mood as well. So it's got a social benefit. And SHAAP and IAS held the Men and Alcohol Seminar Series in 2019 and 2020. And these issues came up in the seminars, and the speakers talked about the importance of masculine identities and their relationship with drinking behaviours, and how men's drinking is normalised in the UK. And interestingly enough, fatherhood rarely featured in these discussions, which is different than what featured in the Women and Alcohol Seminar Series hosted by SHAAP and IAS in 2017. Women in these seminars talked about motherhood, and that was a central theme. So why is parenthood important? Why do we want to focus on that? There is research to suggest that becoming a parent may be a teachable moment when people evaluate their own behaviours and they try to change and adopt healthy lifestyle. And there's certainly a lot of literature showing that this is the case for women. So when a woman finds out she's pregnant, she's more likely to stop drinking, stop smoking, and adopt a healthy diet. There's little research focusing on men, but there is some to suggest that men's priorities change when they find out they're going to be fathers. So they start spending less time with their friends and more time staying at home and spending time with their family. And this suggests that if men are already changing their patterns of drinking, pregnancy might be a good opportunity to talk to men about their health behaviours and their alcohol consumption and how these can change and how they can adopt more healthy behaviours. So why focus on fathers? There are a lot of benefits of what we call involved fatherhood. This is when the father spends a lot of time with the family. When fathers spend time with their children, the positive outcomes for children include improved self-confidence, forming better relationships with people in later life, and children whose fathers are more involved do better at school as well. When fathers spend time with their children, this makes the father-child relationship stronger and the father is closer to their child. It also benefits for mothers. Research shows that when parents share the parenting equally, mothers show lower levels of stress and lower levels of depression. And of course, there are benefits for men. When they're involved with their family and their children, research shows they show more self-esteem as well. And they're more motivated to adopt healthy behaviors. And in fact, they maintain a healthier lifestyle. It's worth acknowledging here that this focuses on involved fatherhood. And separated fathers are one group of men who don't always get represented in research, although they can be equally involved, although they don't live with the mother of the baby. As a whole, fathers are underrepresented in research. And the National Parenting Strategy for Scotland highlighted this in 2012 by saying that when we talk about parenting programs, we automatically think this means mothers. And this highlights the bystander role or the invisibility of fathers in all documents and programs. So the Scottish Government committed to fund projects directed at involving fathers and male carers. So although being involved in the child's life has positive benefits for the children, the mothers and the men, alcohol consumption can disturb this and have negative effects. For example, drinking during pregnancy may increase the risk of the pregnant partner drinking. And when men drink during pregnancy, this can also affect negatively relationship quality and, of course, have negative outcomes for the mother and the baby. Despite this, research suggests that many fathers continue to drink during and after pregnancy, with some studies suggesting that 1 in 5 men continue to drink at hazardous levels before and shortly after the baby is born. And there are potential explanations to why men may continue to drink during and after pregnancy. And we need to go back to looking at the relationship between men and health behaviors and the perception of masculinity. And in fact, research in young fathers shows that men who endorse the idea that a man is to be emotionally, physically, and mentally tough may engage in health undermining behaviors, including drinking more alcohol and smoking. Literature in smoking shows that men perceive smoking as a core element of their father's masculinity. So in some studies, when the baby was born, men continued to smoke, but they smoked outside. So they manage their perception of masculinity that is linked to smoking with the health benefits of the baby. So they didn't smoke around the baby, but they still saw smoking as important part of their identity. Another explanation is linked to stress. And when men become fathers, especially when they go back to work after paternity leave, they might have competing demands. So they might have to manage the responsibilities of being a father with working responsibilities and with a desire to see their friends. And then they might use unhealthy behaviors such as smoking and drinking as a way to regulate these demands, as they offer an opportunity as a hedonistic escape. And Kwon et al. Spoke to 20 expectant and new fathers, and this is exactly what they found, that men continued to smoke because that was their way to regulate all of these responsibilities. And a study in drinking among parents of children up to the age of 10 also found that fathers drink to relax, but they had to negotiate when and how much to drink depending on their parenting responsibilities. So there are two major research gaps in the literature. The first one is that we don't know how men experience alcohol consumption in the context of fatherhood. We can guess what happens when men become fathers based on smoking literature, but we don't actually know whether men use alcohol to maintain certain identities or to manage competing priorities when they become fathers. And if pregnancy is a teachable moment and a good opportunity to talk to men, then interventions need to be tailored for fathers. And there's limited evidence on supporting men to reduce their drinking. But we do know there existing guidance and intervention for women during that period. So to address these two gaps, we decided to do a scoping review. And a scoping review brings together available literature on a specific topic, but allowed us to keep the questions quite wide. So we brought evidence on the impact of becoming a father on men's alcohol consumption. And also we wanted to see whether there are any interventions to reduce drinking among others. So we had 3 review aims. The first one was, what are men's experiences of alcohol consumption in the context of becoming a father? 2, what are the key characteristics of existing interventions to address alcohol consumption in new fathers? Finally, what are the best ways to engage with new fathers in relation to reducing alcohol-related harm? To do the review, we followed a 6-stage framework. So this ensured that the review is rigorous and done in a very transparent way. We followed all the steps. And it's worth noting here that the 6th step is usually optional in the context of scoping reviews, but we decided to form a stakeholder group and discuss with them the implications of our findings. And I will mention the stakeholder group later. We followed all the methods of the framework, and the first thing we had to do was decide who our participants are. We focused on studies that included expectant and new fathers. And if a study talked to both parents, we included as long as they reported data on fathers separately. But if data on mothers and fathers was mixed, we would have excluded the study. To answer both ends, both parts of our aim, we included both qualitative research, looking at interviews and focus groups with fathers, and interventions that aim to address alcohol consumption. We excluded grey literature, so we excluded student dissertations, theses, news articles, and conference abstracts, but we decided to include reports and protocols. We used several definitions. The first one was in terms of alcohol consumption. When we looked for studies looking at alcohol consumption, that could have been any drinking behavior, including moderate drinking, heavy episodic, hazardous drinking, and also alcohol dependence. By new fathers, we meant men expecting a child or whose youngest child is 24 months old or younger. And we decided on 24 months, looking at other literature and what other studies have done in terms of the postnatal period and shortly after, and what we could potentially class as a teachable moment in the first years of the baby's life. Eligible interventions for intervention studies could adopt any approach, whether that would be psychosocial, behavioral, or medical, as long as the intervention addressed alcohol consumption, using the definition of alcohol consumption I just mentioned. We searched 4 databases in November last year, and we combined synonyms for alcohol, pregnancy, and fathers to identify eligible studies. All the screening of studies was done independently by Jody McGarry and myself, and where we weren't sure about whether we should include a study, we resolved this through discussion. So focus on the findings now. We ended up screening 3,304 articles. So this was the titles and abstracts of these articles. And for 41 articles, they seemed eligible at the title and abstract screening stage. So we obtained the full text and read through the whole article to see whether it meets our inclusion criteria. We ended up including only 5 articles in 1 protocol. So 3 of the studies looked at fathers' experiences of alcohol consumption, 2 reported an intervention, and 1 is a protocol intervention to reduce alcohol consumption. So you can see here we didn't find much research at all. So we'll go back now to our aims and try and answer them as much as the included studies allowed us to. The first one is, what are men's experiences of alcohol consumption in the context of becoming a father? We found 3 studies addressing this aim. They were done in Australia, Canada, and the Netherlands. All of these studies included mothers and fathers, so we only extracted data on fathers. And you can see that the small sample sizes were very small, focusing on fathers. So when I talk about the findings and the implications, please keep in mind, I'm talking about a very small number of men in only 3 studies. The first theme we found in the 3 studies we included was in relation to motives for reducing drinking. And in 2 of the studies, men talked about drinking less to support the pregnant partner, or they also said they used to drink with their partner, and when she became pregnant, she stopped drinking. So they missed her as a drinking companion, and as a result, they reduced or stopped their drinking. Only one study, which is the Benoit and Magnus study, talked to men about their drinking in more depth. They talked about substance use in general, so a lot of these men might have been using different substances, not just alcohol. And these men talked about wanting to be a role model for their child. And this was particularly important for men who may have had some dealings with the police or may have had a criminal record. So they said they don't want their child to follow their footsteps. They also talked about the so-called provider ideals. And men talked about fathers as people who need to be able to provide in emotional and financial ways for their children. So they say that when alcohol or other substances interfere with their ability to spend time with their children or to financially provide for them, then alcohol becomes problematic. To give you an example of this, I pulled out a quote from a father in Benoit and Magnus' study. And this father says, in relation to being a role model, that's the way I look at what a father should be. A person whose kids look up to their father and say, this is a guy who stood up to everything in life. The second theme that was only covered in one of the included studies was in relation to knowledge of alcohol during pregnancy. And the authors found that men have an awareness that alcohol can be harmful to the unborn baby, but they didn't know how much quantity can do harm and how often women can drink. And there was this perception that although at the beginning, women shouldn't be drinking alcohol, later on in the pregnancy, it might be okay to have a glass of wine. And this is a quote from a participant in this study who said, I always thought you couldn't have anything. It was sort of not ideal to conceive while you're drunk or be drunk in the first 12 weeks or then to term. But then you see and hear lots more people who sort of think that a glass of wine is actually okay because it calms the mother's mood, which is better for the baby. Another theme that we found in the qualitative studies was that men talked about support for them when they wanted to reduce their drinking. And in one study, men say that agreement to abstain from alcohol was mostly viewed as the mother's decision. And although that wasn't the case for all participants, most of them said that the mothers gave them an ultimatum to either choose alcohol or choose their family. And again, worth noting here, we talk about men who are affected by substance abuse. So it's not necessarily men who may drink at hazardous levels every now and again. Other findings from the qualitative studies, we found that one study asked men about their experiences of antenatal information. And the fathers in the study said the websites about pregnancy seemed unsuitable for expectant fathers. And men talked about the pictures on the website, the content, and also the colors used in these websites. So they didn't think they would be relevant to them. In another study, fathers talked about feeling uncomfortable in parenting groups. And here is a quote to illustrate this from one of the papers. One father in relation to parenting groups said, welcomed, yes. Comfortable, no. Because it's like a lot of the times when you go, I don't know if it's just because I'm usually the only guy. So it's like it makes it harder to participate in everything. So this is all the information we managed to get in relation to a father's experiences of drinking during fatherhood. Second question we addressed was in relation to interventions to address alcohol consumption in new fathers. And we found only 2 studies published in peer-reviewed journals focusing on interventions and one protocol. One of the studies was a randomized control trial, and the other one was a developmental study. So they didn't actually assess the effectiveness of the intervention, they just developed an intervention. And the randomized control trial was done in the USA. The developmental study is in Australia, and the protocol is for a study that will also be done in Australia. And the samples here, of course, are big, given we're looking at intervention studies. The developmental study had 51 men, the majority of whom were current fathers. And the randomized control trial had 348 men who were randomized in the intervention or comparison group. So to give you a little bit more details about the intervention studies, the randomized control study was the only one that assessed effectiveness. But that wasn't an alcohol intervention. It was actually a smoking cessation intervention, and alcohol was a secondary outcome. So it was a couple-based intervention. The researchers delivered the intervention to both members of the couple, to the mother and the father. They gave them a booklet on quitting smoking, free nicotine replacement therapy for 6 weeks, and then a combination of face-to-face counseling and phone sessions during pregnancy and postpartum. So the intervention focused on setting goals for reducing smoking, and it focused on improving the communication between both members of the couple. The intervention components did not include anything on alcohol. Alcohol is just measured as a secondary outcome. The second study was a developmental study, and they developed a text message intervention to reduce drinking in expectant and new fathers. There were 30 text messages to address alcohol-related harm, and they focused on other issues such as infant health, the spousal relationship, the father-infant relationship, and father's health, and how alcohol may affect all of these things. The intervention is informed by theory. So that's motivational interviewing and the stages of change model. Both of these theories are widely used in alcohol intervention research. The new thing about this intervention is that they presented the intervention text messages either from a child's voice or from a second person voice. So it would be either the child addressing their father, saying, "Hey dad, do you know how many drinks you can have before it affects your health?" Or from a second person voice, asking the father the same question. The last study we included is a protocol for a text message intervention. The authors have done quite a lot of preliminary work in developing these interventions, and they have a couple of published studies looking at the feasibility of the intervention, the acceptability among fathers, and they also have a paper suggesting why the intervention would work from a theoretical point of view and what the active components would be. These papers are not included in our review as they didn't focus on alcohol specifically. And actually, out of the 294 messages the intervention includes, only 25 of these focus on alcohol. And the authors didn't say in the paper what information is in these 25 messages. But the intervention is currently ongoing, and I have put the website here if people want to have a look at it in more detail. In the protocol, it said the messages will be timed according to the baby's expected or actual date of birth, so they should be quite relevant at specific points in time. And they use humor. Again, they use baby's voice, which is similar to the intervention I just talked about. And they are written in an encouraging and non-judgmental way. So they should be able to engage men and hopefully change their behavior. And finally, the last question we addressed was about the best ways to engage with new fathers in relation to reducing alcohol-related harm. If pregnancy is a teachable moment and a good time to talk to men about their alcohol consumption, and there might be programs that we can use to engage with men, we need to then find out the best way to reach the fathers, especially given they're underrepresented in research. Looking at what studies included in our review did, the majority of them recruited men through antenatal clinics, hospitals, and other venues where the fathers go. So, for example, antenatal classes, pregnancy courses, or parenting groups. Another way they recruited was through gatekeepers, and this included health professionals who recommended the study when they met with the fathers, but also included women. So in one of the studies, they phoned the women and asked them for permission to talk to their partner. So after the woman gave permission, then the researchers contacted the dad. Social media is also used to recruit men. Say that only one of the studies we identified reported data on how many men they approached and how many agreed to participate. So although studies used all of these methods and they recruited the number of men they wanted to recruit, we don't actually know how many men they had to approach to reach their target. So we don't know how effective these recruitment strategies are. So to link all our findings to wider literature, I will talk about what other studies have found on the topic. So one of our first findings was that men do talk about wanting to be a good role model for their children. And another study with slightly older children, so it didn't meet our criteria. In that study, fathers talked about not setting a bad example or putting their children in danger. So some of the men in this study said that when they drink at home, they think this sets a bad example for their child, so they would only drink outside the house. Which is also similar to what we know from smoking research, that when smoking forms part of a man's identity, they started smoking outside, not in front of the baby. Previous research also suggests that men may feel out of place at antenatal classes, and this is similar to what we found in one of the studies included in this review, that men may not feel comfortable in these classes. Miller and Nash did 2 qualitative studies, both in the UK and Australia. And in the UK, men said that they did feel out of place and they felt uncomfortable at parenting antenatal classes. The men in Australia felt more welcome, especially when the midwife was a man. But they also said that some of the antenatal classes, men talked about specific male stereotypes, such as men watching sports and drinking alcohol. So this didn't sit well with them, and they felt a bit out of place when these male stereotypes were brought up. And these are important because we know that perceptions that interventions are mother-focused are barriers to fathers participating in research and in programs. In fact, the Fatherhood Institute did a review looking at parenting programs and highlighted this about 10 years ago. So if it's a good time, then interventions need to be father-friendly, so they engage with men successfully. And one of the studies we included in the review was a family-based intervention, which suggests that a family-based intervention might be suitable to address drinking in men. Smoking literature does provide support for this, so there are more interventions in smoking, and the intervention we included was a smoking intervention, although alcohol was reduced as a result of a smoking intervention. And McGrady et al. Have a lot of literature focusing on behavioral couples therapy, which focuses on improving the couple relationship and improving communication between the mother and the father, and as a result, reducing alcohol consumption. So there's a lot of support for family-based interventions, but given we only included one study, it's really hard to know how effective these would be for reducing alcohol consumption. There is support for the utility of text message interventions. And one of the studies we included was a developmental study of a text message intervention. The protocol also proposes to do a text message intervention. And we know that text message interventions are effective to address health behaviors in pregnant women. Again, women might be more motivated to adopt healthy behaviors, given that they're the ones who are pregnant. We don't know whether that would be the same for men. But there's also support in the wider literature in relation to text message interventions and them being effective in engaging with men. An intervention done in Scotland by Crombie et al. Developed narratives that were delivered to men living in disadvantaged areas in Scotland in a text message format. So in the narrative, there was a key character, a man who drinks quite a lot in the beginning, And then he follows key steps of the behavior change process. So he would set a goal, he would review the goal, he might not meet the goal and maybe start drinking again. Then he would go back and maintain that goal. And finally, he meets the goal. And the study found high engagement for men. So men engaged with the character, they identified with the character and tried to adopt similar behaviors. So there is potential for narrative text message interventions to engage with fathers. And finally, our review suggests that it is feasible to recruit expectant and new fathers through antenatal clinics, hospitals, and other classes where men may go. But the problem here is these are the men who are already involved in the pregnancy process. So separated fathers might be excluded from this, or in fact, any other male carer who wouldn't go to these classes might be excluded from fatherhood programs. Social media offers an alternative. So men could be recruited through Facebook, Twitter. Again, that has limitations given that would only recruit men who have access to social media. But recent study shows that vibrant images with concise captions may actually increase engagement of men in health research. The other option for reaching out to men is using women as gatekeepers. And although one study we included in the review showed that this is feasible, and the women give permission, then the man is more likely to take part in the research. But again, there were caveats here because that puts the woman in a position whether she has the power to decide whether she wants her husband or her partner included in the parenting intervention. And again, that would also recruit men who are potentially already involved in the pregnancy, excluding separated fathers and other male carers. So to summarize our findings, we found that pregnancy is a good time to engage with expectant and new fathers, but this is based on very small samples and only 3 qualitative studies. So the overall conclusion in relation to men's experiences of drinking in the context of fatherhood is that the experiences of fathers have been largely neglected in alcohol research. And in fact, when we're screening the titles and abstracts of eligible studies, we found a lot of research focusing on mothers and asking mothers about their experience of drinking and the barriers they face for stopping drinking during pregnancy. And some studies ask mothers about how fathers can support them better. But as you can see, there's very limited research actually exploring men's experiences beyond supporting their pregnant partner. And it's a good time to talk to men, then we need to know what is the best way to actually engage with men and the best way to design interventions that are father-friendly, especially given that men may feel unwelcome or uncomfortable at antenatal classes or find antenatal websites not to be suitable. The findings have implications for researchers and also for health professionals. The first one is that there is a need for more qualitative research, and ideally there will be longitudinal qualitative research. Given that stress can compromise intention to adopt healthy behaviors, longitudinal qualitative studies can explore men's experience of drinking before the baby is born, shortly after, and potentially after men return to work, where they would have more competing demands. So it's possible that during pregnancy, men do adopt healthy behaviors, but when they go back to work, they might adopt unhealthy behaviors such as smoking and drinking to manage all the stress. And similarly, the social context of drinking at different time points might change. Again, during pregnancy and shortly after, men might stay at home and help and not see their friends as much. But when the family gets into a routine, it's possible that men do go back out to see their friends and drink more. So longitudinal qualitative studies exploring this would also be beneficial. Studies also need to include a diverse sample of fathers. Given the small number of men in the studies we included, we can't reach any conclusion in relation to differences in behavior between different fathers. But wider literature suggests that younger fathers, first-time fathers, and when the pregnancy was planned, are more likely to be involved and adopt healthy behaviors. And there is hardly any research on separated fathers and what behaviours they adopt. And the Fatherhood Institute published a brief article on their website focusing specifically on separated fathers back in 2008. And we still didn't find any studies focusing on separated fathers. Future studies also need to focus on successful strategies to engage with new fathers. So social media might be a good way to do it, or hospitals and antenatal classes, but studies need to provide information on non-responders so we can actually see whether these strategies are effective. More research is needed to inform the content and form of antenatal information for new fathers, especially given that fathers may find existing websites to be mother-focused. And finally, more research is needed to explore the potential of different types of interventions. And when we talk about antenatal services being father-friendly, it's quite hard to know what is a father-friendly service or a father-friendly program, given the limited research. A recent study tried to find this out by including father cues. So they had men's magazines and pictures of men in waiting rooms in antenatal clinics. And they found that men who saw these father cues, as they call them, so the men's magazines and pictures, showed greater self-confidence to be involved as a father and also greater intention to adopt healthy behaviours. So even simple things such as changing the environment in antenatal clinics might have potential to increase men's intention to reduce drinking. The second point is that it's important for health professionals to link the birth transition to fatherhood rather than simply prepare men to support their partners. And again, the Fatherhood Institute discussed this in an article saying that when health professionals explain to men how their negative behaviours can impact the mother and the baby, men are more likely to change their behaviour. So it's important to have this discussion with men and not focus only on how men can support the pregnancy. And in relation to this, healthcare professionals need to be aware of cultural norms. And there's some research to suggest that in certain cultures, there is a power relationship between men and women. And a recent review on smoking found that in some cases, women may feel uncomfortable to challenge a man's smoking in the house because of that power relationship in specific cultures. So the baby might be exposed to secondhand smoke exposure. So more research is needed to find out this, and also for health professionals to be aware of potential interactions at home between the mother and the father in relation to culture. And finally, as I mentioned in the beginning, nationwide policies need to explicitly state the role of fathers rather than talk about parents as a whole. Also, when we talk about parents as a whole, it's possible that we continue to highlight the invisibility of fathers and ignoring their role and their importance in pregnancy and supporting the mother, the baby, and changing their own behaviour as well. And finally, I want to acknowledge our stakeholders. When we extracted the data and brought all the findings together, we held a stakeholder group and we're presenting the findings to our stakeholders who helped us interpret them and put them into context and helped us shape the implications. And again, I want to thank the Institute of Alcohol Studies for funding this project. And I'll be happy to take questions.